There's no denying that a respiratory virus that easily spreads is a dangerous thing. The problem is getting a fix on just how dangerous has become political and also confusing. That's because the gravest danger, how many people die from it, isn't apparent right away. So we asked Dr. Jennifer Delahaye for just exactly how many people have died because they got the coronavirus in Arkansas.
1,197 deaths are all of the COVID-19 deaths in Arkansas that the Arkansas Department of Health is aware of.
That includes people who might have been very ill with something else. Health officials still need to list those deaths. The whole process starts with a very important document.
The way we count the deaths in Arkansas is if it's listed on the death certificate.
That means it's up to a coroner, a medical examiner, or a certified hospice nurse. But remember, that's just the starting point.
Death reporting is a lengthy process. And in this day and age, when immediate numbers are asked for, it's not always possible to provide those.
So those numbers we get back every day don't reflect the last 24 hours. And lately, the numbers reflect efforts to go back and check the data again. Our numbers have been on the rise, but not because of a surge. The ADH has been matching cases to death certificates.
We're able to compare those two. And sometimes we find people who have died that we didn't know about in our database.
Those 140 or so probable cases surprised Dr. Delahaye, but the department now also lists non-COVID deaths, people who were positive but died in some way that was clearly unrelated to having the disease. Delahaye expects figures like these to shrink, but says we still have some dangerous days ahead.
My real concern is the number of people in the hospital right now and what that means for a bump in the number of deaths that we're going to have.
Rolly Hoyt, THV 11 News.